Hi, everybody. Hospice Nurse Julie here. Hi. Hello. I'm coming to you from my bed because it's just been one of those days. You know what I mean? I didn't get anything set up. I just got my light right here. Um, it's just been one of those weeks here in LA. Welcome, everybody. Come on in. I love when I come into the live and I see like all the people already on the chat. Let me say hi to everyone because I love you guys so much. It makes me so happy. Beck, Laura, Sally, Jennifer, Kitty, Bella, Julie Teacher, Jennifer, Steph. What's up, girl? Kitty Cole. I like that. Megan. Hi, guys. So happy to see everybody. Really. Hi, Christina. Hi. It's like Lisa, but with an R. Risa. Risa? Salty, Linda, Christy, Kali, Mali. I hope I'm saying that right. Pamela, Carol, Brenda, Cindy, Tammy. Hi, guys. Mark, Justin, Marie. It's Alana or Elena, maybe. One Sock Candy. Love that name. Linda, Dawn, freeze-dried ice cream prepper. Lauren, Mario, Phoenix. I'm not going to sit here and say everyone's name, but I got to tell you guys, listen, just to be like for real. I have just been having one of those days where I just feel like so sad for for like several like big existential reasons, but just like generally speaking. And honestly, seeing everyone here makes my heart feel so warm and just makes me feel so good. So, um, thank you so much. And Lauren, anything on fungal breast cancer? So, Lauren, I don't have anything specific about fungal breast cancer because there's a big, long, there's so much information out there, and I don't specify in like breast cancer, right? So, the only thing I really specify is an end of life with breast cancer. And I do have a video about that. So, you can go through my videos and look. Generally speaking, like the breast cancer patients I see are the ones that have been, in and out of remission for a long time. They usually have very late stage metastatic cancers. So that's what I could talk about, right? I can't talk about specifically fungal. Can you talk about the differences between dying of natural causes? Define what that means, as opposed to things like heart attack, stroke, etc., or do a video on it soon. Let's talk about it now, Phoenix. That's great. So, dying of natural causes. Dying of natural causes means someone is very, very elderly. So, like, I could be wrong here, but in my opinion, dying of natural causes can't happen if you're like 40 because you don't naturally die at 40. Natural causes to me means you're 85, 90, 95, and they don't really know why you died, but it's like natural causes, meaning like you're elderly, you got some stuff wrong with your heart, stuff wrong with your lungs, your kidneys, your liver, all the things because you're just older. So you're allowing the natural process to take over. There's not one specific disease that you're dying from. You're like dying of natural causes. So that would be my definition. I could be wrong, but that's what I think that would mean. And then everything else died from heart attack, died from stroke, that's what they died from. So they can say this person had a heart attack and that's what they died from. This person had a stroke and that's what they died from. This person was in an accident and they were killed from blunt force trauma. Just means the force of our bodies can't handle big forces sometimes. So that's what I would say that means. Now, everyone on hospice, I would consider them dying a natural death. They are still dying from something, but they are still allowing the natural process to take over. For real, it's been 1 month and a week since my mother died. Yes. See, I'm so glad we're all here as a community to help each other. My mom has cachexia, just went on hospice. Yes. So, artsy cat, as long as her symptoms are managed, like, and she doesn't have a bunch of pain or anything, um, her body should, like, naturally be able to start shutting down. Someone like that with cachexia just means, like, malnutrition and, they can't keep their nutrition up. It should be pretty peaceful as long as she doesn't have some, like, underlining issues. Does it hurt to die from cancer, or is it just in general? I don't know, I'm just asking. It can hurt to die from cancer. It depends on the specific type of cancer, where it's at, if tumors are involved. There's a lot of factors when it comes to that. Thank you so much, Faith Goodman. Thank you for being here from the UK. We're worldwide. Laura, I'm glad you're here. Thank you for caring for your Aunt Susie best you can. My aunt turned 90 and out of nowhere she doesn't seem as sharp and looks more frail. Isn't that that is how it happens sometimes. And 90, and I don't ever want to poo-poo people just because they're elderly, right? But we do have to know that, like, eventually people will start I know what you mean when people start, like, kind of looking old and or looking frail, and you're like, "Huh." But generally speaking, I feel like when someone is 90, whether they're the healthiest 90, they could be getting towards their end of life journey, right? Oh, Juliet, thank you for being here, and thank you for trying to be there for your mom. If someone chooses VSED, which is voluntary stopping eating and drinking, would sedation or not being aware an option? They probably couldn't, like, fully sedate Diane just legally. They definitely, if you can get a hospice involved, which I strongly suggest people work with doctors when doing VSED, you could definitely get medications to help, like, ease the because it can feel a little distressing not eating and drinking when your body, like, wants it. So they definitely could give medications to help, like, relax and give morphine or Ativan, but probably not enough to, like, truly sedate. Because then you're getting on the cusp of, like, kind of helping, and that's technically illegal. So they definitely could give medication, but they wouldn't give enough medication to, like, palliatively sedate or anything. Hi, Kathy Johnson. Hi, Julie. First time sharing. Have you heard of the Kennedy ulcers? Yes, I've heard of the Kennedy ulcer. I had made videos about it, not on YouTube, but on other platforms. The reason why I don't talk about it much. So, Kennedy ulcers are ulcers that develop in people right before they die. And a lot of times they look like big bruises on someone's butt. They kind of can look like a butterfly too. And they can develop right before someone dies on their butt, and a lot of time that can signify to people, ooh, they might be getting close because they have these big Kennedy ulcers. The reason why I don't discuss it is because a lot of times I feel like people get, skin breakdown for so many reasons, and I don't want people to think that they see skin breakdown on their loved one and they automatically think, "Oh, they're gonna die now," because so many people can get skin issues and not be dying. So I never want people to, like, make that distinction and, like, freak out because they think their loved one's dying just because they see skin issues, which is not true all the time. So that's why, and sometimes Kennedy ulcers can look like regular skin stuff, right? So I don't always talk about it because of that. I don't want to make people feel like on high alert. What are some signs of end of life? Signs of end of life are, well, one, you have to have some kind of terminal diagnosis usually, or be very elderly. But even then, you can live a long time. I've had a patient who was 109, a patient who was 106. Um, but mostly not eating and drinking and sleeping, not eating and drinking and sleeping, not eating and drinking and sleeping, more and more and more. Your loved one's sleeping more than they are awake, not eating and drinking. However, people with, like, dementia, they can really go for a they could, even if you're just barely eating, they can live quite some time even like that. But generally speaking, You have to have some kind of terminal illness. You know they're getting towards the end of life because they're sleeping all the time and they're not eating and drinking. Sleeping all the time and not eating and drinking. Another thing you can think of is actually I'm gonna do actually did a video about this. I'm gonna post it in the next couple of days about like when to know when hospice is the right thing to do. Or like when to stop treatment. And it's usually you start seeing someone who needs to go into the hospital over and over and over again. Okay, let me see. Skin breakdown is totally normal, I learned. Yeah, skin breakdown can be very normal and almost expected, specifically if someone's bedbound for a long time. And it's not expected. We do not expect to heal any wounds on hospice, just keep them free of infection. My mom looked up death rattling and said it could either be today or tomorrow or Saturday. Wow. So your mom sounds like she kind of knew. Oh, artsy cat. Okay, good. I'm glad morphine and Ativan are on board. I'm just looking through the chat, you guys. Welcome, everybody. If you're new, I'm Hospice Nurse Julie. I go live at 5 every Thursday on YouTube. This is where you can get your questions answered best of my ability. If I keep missing your question, please write it in all caps. It's a beautiful community here. Several people come every week. We all support each other. So thank you so much for being here. Does morphine help blood pressure? Not if you actually have like genetic high blood pressure, but if you're like anxious and you have high blood pressure, morphine can help because it can relax. But if you have like genetically high blood pressure or heart disease or things like that, it probably wouldn't help with blood pressure. But a lot of times when you get towards the end of life, blood pressure goes down and stuff anyway. Thank you, Jasmine. Beck says, with my husband is on hospice. They are giving him too much meds. That is what he said. Stomach cancer has other issues. Beck, you can always have a family meeting and talk to your nurse and doctor about you think they're giving him too many meds. You can see. At the end of the day, a lot of times we need to give a lot of medications to help manage symptoms. So you have to outweigh. It's like a lot of medications, symptoms controlled. Not a lot of medications, symptoms not controlled. Right? So it's like which is the lesser of evil, right? Or whatever that saying is. But if you think that still you can always talk to your hospice company, hospice team and say, "Hey, this is what I think. Can we get a meeting together, go over all the medications and see what we can do." Thank you, Megan. Don't forget on the bottom right of the screen, there's a heart. Hitting that heart somehow helps, I think helps my live. So while you're doing this, if you like this, do that, please. I think it does. Thank you. Have you ever encountered paranormal or spirit leave someone who died? I have not seen that, Christina. I haven't seen like a spirit like leave a person or anything like that. I have not seen that. I do feel like the feeling I get when I see someone take their last breath, feel I don't ever see anything, but I do feel like I feel something, and it feels like a baby being born. Like, like it feels I think because the grief for me is removed because it's not my loved one dying, it feels like how it feels when you witness a baby being born, when it's like, oh my that whole like, oh my gosh, like no matter whose baby it is, if you watch it online, it's still that moment of seeing a brand new baby and you're kind of like, oh, where did you come from, baby? I love you. I would never do that while the person's taking their last breath, but that's kind of like the energy, like there's an energy shift a little bit, and it feels like that, like they've gone, but it's like they're reborn into the place that they once were or something. And that's just my belief, right? It doesn't necessarily mean that's actually what's happening, but my mom has been on hospice for 2 years, and her hospice nurse, Whitney, said she has the Kennedy ulcer. We think it's her time is close. She has suffered so much. Oh, Kathy. It's crazy. We were just talking about the Kennedy ulcer. I don't think you were the one who asked that question, were you? Yeah, I mean, she's been on hospice for 2 years, right? So it's like you just take it a day at a time. You remind yourself, is she clean? Is she safe? Is she comfortable? If she is, just be with her, right? Just be with her. I have a fear if going to heaven and no one is there to greet me. All I hear is crickets. Oh, I think it's normal to fear all of the unknown stuff. I mean, it's normal. I don't want to sit here and go, don't worry. That's not what's going to happen. I don't think that's fair either because none of us really know. And I do understand that it's normal to have fear and the things we don't know, the things we don't understand. I personally don't feel like it'll be like that. I feel like you'll wake up and it's going to feel more like home than here ever could. But it's normal to have fear and it's important to talk about it. So thank you for saying that to us. I think expressing it's the best thing you can do for yourself. Yes, YouTube is not showing me any vids when they are live. A bunch I don't watch at all or a little. Yeah, I think with YouTube you might have to like go to my page directly and like look through the videos. I think. I'm just reading through the questions. Thanks so much. My mother-in-law has cancer. She was on TPN, which is intravascular nutrition, just so everyone knows. But she was taken off on Saturday. She's sleeping a lot. And here breathing is off. I don't know how to explain. Brenda, that makes a lot of sense. That makes total sense to me. Is she on hospice? I would ask if she's on hospice. It makes total sense. If she's not on hospice, then I think you should talk to her doctor and see what's going on. But all of that, if she is end of life, makes total sense to me. Again, you just ask yourself, is she clean? Is she safe? Is she comfortable? If you think she is, then it's okay. If you don't think she's comfortable, you can talk to your hospice company and see what they think. But the breathing stuff is normal as long as she's comfortable. Now, if she's truly having changes in breathing, she could be like getting very close, like the last few days of life. And again, nothing different you have to do except for be there for her as long as she's on hospice here. Okay. Like, I don't want, I don't know. I don't think you said if she was or not. So, my mom has congestive heart failure, a pacemaker defibrillator, and is going on to hospice. Why would they leave the pacemaker on but shut off the defibrillator? Because the pacemaker will not keep her alive. It's just going to pace with the same electricity of the heart. So once the heart stops and electricity stops, the pacemaker will stop. It's not going to keep her alive. But sometimes when you are at the end of life, your heart can go into weird heart rhythms, and you don't want to have the defibrillator on because the defibrillator will shock her and it can be painful. So you always want to turn off the defibrillator, but you can keep the pacemaker. Um, Are you religious, spiritual, Julie? If so, does it help you with processing often dark emotions you're probably around while on the job? I am I'm definitely spiritual. I do love me some Jesus, probably just not the Jesus we hear in the news a lot of the time. I feel like I had a spiritual experience with Jesus and would have considered myself a Christian for a very long time. The and I'm not going to get into an argument here, so no offense to anybody, but the longer I was in the Christian church, the less I wanted to be involved because it didn't feel very Jesus-y to me, except for a few like Episcopalian churches and things like that. So yeah, I'm spiritual. I definitely believe in a higher power. I love me some Jesus, but I don't believe in anything like hell. I don't believe that everyone has to believe in Jesus or they're going to hell. And all of that stuff has not only helped me in my job, it has helped me in life in general. And yes, dying is a very spiritual thing to me. And I think the only thing that matters is like a relationship with my higher power. I don't always act like that, but that is how I feel. And the closer I am to the thing that I call my higher power, the more loving and accepting I am. How do you know when it's time to transition into hospice? My mom has stage 4 cancer and she's been in hospitals more than at home. It's very tough, and my heart goes out to all the same place. You only can decide for yourself. I have a whole entire video on this, and it's going to come out, I think, either Friday or Sunday. Generally speaking, if the doctors are saying there's not much more they can do and she's in and out of the hospital all the time, I do think it's time to start thinking about hospice. That is just me. So make sure you talk to her doctors and talk to her, right? Of course, see what she says. Generally speaking, I feel like you get there's a whole video. I'm going to put a whole video out, but the gist of the video says if you keep going in and out of the hospital, in and out of the hospital, and they're not doing much in the hospital and our symptoms are getting worse, and I do feel like we likely know whether she stays on treatment or whether she doesn't. Her time here is still probably coming to an end-ish, right? So how does she want to spend that time? That's what she has to decide. And if she can't decide for herself because she's not mentally with it, that's what you have to decide. And talk to her doctors who are working with her. I know this sounds crazy, but is my husband died when I was 6.5 months pregnant with my son. Not even 3 days later, he came and visited me, my daughter, and myself. It looked as if it could be when he lifted off the bed. Oh, sorry, Christina, this kind of cut off. Shoot. Personally, I'm not religious. I'm just reading through the comments. Just reading through the comments. Oh, it's okay, Precious. Thank you for trying. Joe, I'm sorry, that would be frustrating. My mom passed after having a stroke. After no medical intervention was feasible, they gave her morphine drip. Does that take the pain away and relax a person where they could pass more quickly? I don't know if they pass more quickly, but definitely it basically takes the edge off. It helps the whole body kind of relax, the central nervous system relax, and it makes someone be like, yeah, it would take the pain away, help them feel good, help them relax. And what made her die, I would say, would be the stroke. What helped her die more peacefully, I would say, would be the morphine. So it's like she would have died whether she was given the morphine drip or not, because there was no medical intervention feasible, like possible. But with the morphine, it helped her die more peacefully. Possibly a little sooner, possibly, but it definitely isn't something that's like quote unquote killing her. Um, what did that was is the stroke. Thank you, Julie teacher. Thank you, Genesis. I hope I'm saying your name right. Thank you, Lisa. Oh, photo finish says a friend was put on hospice. At her very last breath, I saw her smile and she squeezed and pulled her husband's hand. Um, is this something you've seen before? I've definitely seen people smile. Yes. Um, yes, it's really beautiful. I've seen so many beautiful things. Ooh, Squish says, I was recently put on a vent against my wishes. What obligation does the surrogate have to do to obey your wishes? Ooh, I actually think if you once you are unconscious and can't make your own decisions, the surrogate can like do what they want. So you have to choose someone who's going to respect your wishes. Morphine is not the only drug they can give. Laura, I can't explain that. No. I would have to know a lot more medically about why you would feel cold inside. Have you heard of the Jeffersonian Bible? I think it was compiled by Thomas Jefferson and contains the words of Christ as well as nature and morals, no Old Testament. I have not heard of that. No. Thanks, Elma. Not thrilled Andrew says, "Not thrilled with my hospice company, but seems like too much trouble to switch. There's a risk the next one is worse." Oof, Andrew, I get it. The one thing I would say is, like, t maybe you've already done this, but, like, try to have a family meeting with, like, your whole team, the doctor, the nurse, the social worker, everybody. Explain that you're not very happy with them, see if they can help with the expectations, or talk to the supervisor or something. Maybe you've already done all of this. And I get what you mean. You're like, if it's good enough, I guess I'll deal with it because it would be a lot of work to switch. Or if you really want to switch, you could say to the other hospice company, "Hey, I want to switch because this is what this hospice company is doing and I'm not happy about it. Are you going to be able to meet my expectations? Here are my expectations." So give them your expectations and see if they can meet them. Of course, they might say, "Yes, I can," but maybe they won't. I also am coming out with a video very soon about what to expect from hospices because I do think there's a lot of confusion on what hospices do versus what they don't do. Hospice keeps saying my dad has maybe days left, but they have been but they have not been right for the last 2 months. Please advise. Sh Shabby Chicky, it would be hard for me to know without knowing anything about your dad. So, I would say if they're saying he has a couple days left, he probably does, but you've been saying they're wrong. So, to me, someone who has a couple days left, here's how they look: fully unconscious, not eating and drinking. Fully unconscious means they aren't waking up to like tactile like stimulation. They don't wake up at all. No eating and drinking. So not waking up at all. No eating and drinking. Incontinent. So they haven't had food and water for a few days. Unconscious. No eating and drinking. Then they'll start having changes in breathing, changes in skin color. So if those things are happening, I would say yes, there's likely only a couple days left. But if those things aren't happening, I don't know what they're talking about. Thank you, Brenda. Thank you to everyone saying Brenda. Thank you. Thank you, Brenda. Also, shabby chicky. I'm sorry that you're going through this. It's hard. In the USA, when someone dies, do you open the window to let the spirit go or fly? We did it for all of our family in the UK when they died. Faith, I don't do that unless someone asks, only because I don't want to add one, I don't actually think we need to do that, but that's not that that is wrong if you do it, right? So I would only do it if someone asked because I feel like if I did that and then I said to the family, "Oh, I'm doing that so the spirit can fly away," they'd be like, some families would be like, "We don't believe that," or "We don't believe there's a spirit," or, I don't know. So I don't do anything like that just because I want to do what the family wants me to do. But I think that's great if people want that for sure. I didn't see your question, Bermuda guy. Retype it, please, in all caps if you can. Sorry. Thanks, Peggy. Nighthawk, I'm glad you're here. I'm sorry it's been hard. I keep just looking through the comments. So, welcome everybody. Thanks for everyone who joins. I'm here every Thursday, 5 p.m. Pacific Standard Time. If you wonder who I am a hospice nurse. My name is Julie. I go by Hospice Nurse Julie online. Okay. Do most hospice workers believe in an afterlife? I don't know. I don't ask. I don't ask. Honestly, as nurses, we are talking about nursing stuff most of the time, right? We are not going around to each other being like, "What do you think about the afterlife? What do you think about that? Did you see a spirit leave?" We're not, we are, people always, I think a lot of people think, and I know this because they ask me, they think we're not like actual nurses. So like we're doing a lot of medical stuff. So like really my job as the nurse with the patients is to do medical things. So very rarely are we talking to each other about that. But I would bet, but I don't know. I was told to get funeral arrangements sooner rather than later. Thoughts? Yes. Get funeral arrangements sooner rather than later. I agree with that statement. How do I deal with the nurse that thinks I'm an annoyance because they don't like their jobs? Are you the patient or are you the family caring for your loved one on hospice? Can you ask for a new nurse? Can you ask for a new nurse? And as long as you're being appropriate and asking, and like asking for medical help. Now, if you're asking for other things that's not their nurse's job, then she doesn't have to act annoyed, but she can put a boundary and say that's not my job because that isn't. But if you're talking about, stuff that they need that's nursing involved, then you could always ask why she's being like that, he or she or them, they. Um, or you can ask for a new nurse. Oh, Tammy, I've been missing your question. I'm sorry, sweetie. I just saw the only thing I saw is she writes, I've been posting in all caps, and I just haven't been seeing it. I'm sorry. Anyone who wants to ask a question, ask away. Don't ask to ask, but just write it in all caps so I can see it. Not every question has to be in all caps, but it's more likely I'll see it if it is. I'm loving your book. Thank you, Juliet. Thank you. Do mental health professionals work in hospice? Yes, they are the social workers. They are amazing. Why do hospice nurses get a crazy look when I suggest that I would take my life off hospice and go to the hospital for active care? She passed, but it still bothers me. Why would hospice nurse get a crazy look when I suggest that I would take my wife off hospice and go to the hospital for active care? Because they're thinking, why are you on hospice then? The whole point of being on hospice is so you don't have to take someone to the hospital to get active care. The point of being on hospice is to allow the person to die a natural death on hospice. So they are thinking, I mean, they don't need to give you a crazy look. They could just be non-judgmental and say to you, oh, well, then why are you on hospice? Being on hospice is so you can die a natural death at home on hospice. So if you don't want to do that, why are you there? Why are you on hospice? That's why they were thinking that. Deathbed visions, why don't some people have them? We don't know. We don't know why some people have them, why some people don't. We have no idea why some people don't have them. And if they don't have them, it doesn't mean anything. It doesn't mean anything. But we don't know why some people don't have them. And a lot of people don't tell people when they have them. What's the most important thing you've learned while doing your job? Appreciate your health while you have it. Talk about death even if you're scared. Those are the two things, two most important things. Appreciate your health while you have it. Talk about death even though it's scary. Plan for your death. Assume and know that you're going to die. Assume. We don't have to assume, we know. And it's like now, here, now. Like that's so like and plan for it. This idea of like it's not going to happen, it's out here somewhere is not helpful. Particularly if you have we can't always plan if we get hit by a bus or something, but Which why do people always say that? That's such a violent death, hit by a bus. Jeez. But but if you are diagnosed with something terminal or something that's going to be terminal or something that's likely terminal or something, start planning now. This idea of like denial, denial, denial doesn't help anybody. Doesn't help anybody. Can't you be on hospice and be in the hospital? No, you cannot. You cannot be on hospice and be in the hospital. You cannot have those two things. Unless you're a child. Children's hospice is different. So adult hospice, you cannot be in the hospital and be on hospice. In America, anyway. Oh, the name of my book? The name of my book is called Nothing to Fear by Julie McFadden. Nothing to Fear by Julie McFadden. And it's a best-selling book because of you guys. New York Times bestseller, thanks to you. Not all hospice die at home. They do have nursing facilities, yes. So that's great, Precious. Not all, so if you don't want to die in your home specifically, or you can't physically take care of your loved one, you can go to a skilled nursing facility. You can go to an inpatient hospice if they have it. But you can't be receiving active care in the hospital, meaning like chemo, radiation. You're not supposed to go to the ER to get symptoms managed. The hospice company is supposed to do that for you. Thank you. I don't know how to sound out names, and it's so ridiculous. I know your name is so easy to say, but I can't pronounce it. And I even worked with a woman with your same name, and I still can't pronounce it. Why? Your last name is Saylor or Salyer, Salyer. How the hell do you say your name? Why am I blanking? This is when I'm like, I have a learning disability. I have a learning disability. I cannot pronounce names. Oh, how can I learn to not be overwhelmed when I lose somebody? I think it's okay to be overwhelmed when you lose somebody. But I think therapy, medication, like if you really feel, I don't know anything about this stuff, right? But if you really feel like you're not coping well in life, right? And you don't know how to manage your emotions and do it, like there are things you can do for that. That has nothing to do with, managing how to manage your emotions, how to take care of yourself. Talk to a therapist. There's medications. There's so many things out there. Hi, Julie. Can we get sedated when we are dying? The suffocating freaks me out so bad. I want to be very sedated at the end of life. Gabby, I can almost promise you wholeheartedly that you will not feel like you are suffocating at the end of life. And people who are dying at the end of life on hospice, particularly when you see those changes in breathing and it feels like they must be suffocating. They are not. They are not. They are not. That's a metabolic change that happens in the blood. Hi, Roy, my doggy. Metabolic change that happens in the blood that makes people stop, that makes people change how they breathe. But people interpret that as like them suffocating, but they're not. I feel bad for using all caps. I swear I'm not yelling. But how can I send a voice of my mom an hour before she passed to show the death? How can you? You can send it to my email if you want, at hospicenursejulie@gmail.com. Hospicenursejulie@gmail.com. Is that what you mean? I can listen to it later, not now. I think that's what you mean, Juliet. Oh, Faith. It's not a common thing. No, but I hear a lot of it because I have a lot of people in from the UK. We had a friend over on Christmas Day. She suddenly passed the next day. Professionally, I know I couldn't have done anything, but I still feel bad for not picking up on it. Oh, I know. I'm so sorry. Death can really make us feel these weird feelings, can't it? Can't it? Thank you, Carrie. Maybe suggest to your followers to share your book with family members. Yes, if you have my book, give it to somebody. If you have it and you have already read it, give it to somebody else. Give it to your family, your parents, your sisters, your cousins, your aunts, your grandparents. I think, yeah, it's for everyone. So pass it around. Pass it around. Share it. Does insurance cover hospice? Yes. Hospice, for the most part, should be totally free. Whoop, see what happens is I'm trying to go, like, question by question, and then I just scroll down a little bit, and then it, like, takes all the questions away, so I think I missed chunks. My last name is McFadden. Yes, Julie McFadden. My insurance is telling me I can't be on hospice unless I'm homebound, and I'm not homebound? Allison, are you in America? Okay, Allison, I need to know more of your Allison, tell me how old you are, if you don't mind. Tell me the disease that you're going on hospice for. So, you can only be on hospice if you have a terminal illness with less than 6 months to live. I will, Nighthawk, thank you. Mustache Richie is in the other room. The craziest thing I've ever seen is a woman come back from being actively dying. This woman was actively dying, looked like she had minutes left to live. She was totally cyanotic, which means blue. She was not oxygenating, meaning her brain was not getting oxygen. Absolutely no way. She was agonally breathing, looked like she would die any moment. And then I left the family eventually because I had to go home because it was getting late. I thought she would die for sure in the next few minutes. She never did. The next morning, she woke up. She said she was hungry. She got up. She ate pancakes. She lived another 3 months. That was not the rally because she lived for 3 months. The rally, you would do that and then die suddenly after. That's when I saw the angel. Remember my angel story? Most of you guys know that. Have you seen what Kelsey Sheeran has shared about Made in Canada? I don't think so. Sorry, I'm just whenever I'm going like this is because I'm like reading the comments. Have you experiences from your experience as a hospice nurse, do you find evidence of something after death? And if so, what made you think there was? So I've always felt like there was. Ever since I've been a little girl, I definitely was like a little girl who was like 4 years old and had like existential dread and like constantly talking about like existential questions to my mom, like, where do we come from? Where do we go? What are we here for? What's this all about? I've always been like that. I've always been someone seeking for things. So I've always had a belief in an afterlife for whatever reason. I don't know why, right? I don't know why I believe in those things. It just feels like there is. I feel like I'm attached to it. I feel like I miss it. I feel like I long for this place that I once knew. I yearn for it. And being in hospice has made me feel closer to that place than ever. And when I watch people take their last breath, I feel very close to that place. And when I watch babies being born, I feel very close to that place. So to me, there's something about it. It's like where we go, where we come from. It's all the same. And I feel like it's going to feel a lot like home. That's what I think. That's my belief. But I really, really understand that that's just my belief. And I don't want to ever try to force someone to believe what I believe. Okay, I got some questions. I'm seeing your questions. D. Sears. Julie, my mom's on palliative care. She hasn't eaten or drank since Thursday. She has dementia, Alzheimer's. She's hanging on today. Her blood pressure was 60. Oh, how long? It's really hard for me to know. People with dementia do act much different sometimes. Sometimes they can have these episodes where they're like this and then they come back and it goes back and forth. But if she truly stops eating and drinking like since last Thursday. Oh, so it's been a week. Um, I would talk to your palliative care team, right? My number one thing is like don't get medical advice from an online hospice nurse. Okay? Don't take this as medical advice. This is just what I know. So if someone truly hasn't eaten or drank for a week, they are definitely getting very close to the end of life. So I would say and I don't know if this is true or not, but she would be likely unconscious, asleep 24 hours a day. I would say just keep her clean, safe, and comfortable. And I would assume she would be in the actively dying phase, which would be, which usually lasts a few days. Um, Someone usually will die from after having no food and water for 7 to 10 days, but people surprise me, specifically dementia patients. What I would do is talk to the people who are caring for her and see what they say. But I would say she's in the days area, but that's just from reading that one little paragraph, right? So talk to your healthcare workers. Julie, please tell me something I can comfort my wife with after watching her mom die at home with us under hospice care, but with no hospice here, just me and her. Yes, which is very normal, by the way, which I'm doing a video about from dementia. Let her know that she did the best she possibly could. She did the best she possibly could. Everyone has an end of life journey. Everyone. When someone dies, someone dying, although it's very painful and very sad, is not, I believe, is not the worst possible outcome. The worst possible outcome is trying to force someone's body to be alive. And when someone's very elderly and they have dementia and Alzheimer's, their body is going, hey, enough is enough. Enough is enough. And to allow their body to be the guide and to allow their body to go through the process of dying naturally, which is what happens with people with dementia. They're not like starving to death. They're not thirsty. The body is shutting down. The brain shuts the hunger and thirst mechanism to shut down. So you are giving the person the best possible outcome, I think, because you're allowing them to die peacefully at home with you, people that love them. So I hope that can help a little bit. When I'm done with this live, it goes on my page, so you can always have her watch it, and it's gonna be around 46 minutes in. She did a very good job, and she did the best she could for her mom. What's the major difference between children's hospice and regular hospice? Christine, I have no idea because I don't ever work on children's hospice. I don't know. It is different though, I know that, because I do believe that children's hospice, you can still be in the hospital and be getting treatment and be on hospice, I think. Hi, when an elderly person is dying, can a doctor or hospice nurse use the stethoscope to listen to the heart and predict how much time they have left? No, no. No one could do that. That's not how you can predict how much time someone has left. There are many other things. So you would look at their disease, right? What kind of disease they have, what the predictions are when someone has that disease, and so that disease can help determine. Thank you, who just ever gave me $5. Um, they would look at how much the person's eating and drinking, how much they are sleeping. Those two things can really, really help. And it's not a matter of like forcing someone to eat or forcing someone to drink to keep them alive. It's like we know they're dying because they're not eating and drinking. They're not dying because they're not eating and drinking. It's the other way around. They're not eating and drinking because they are dying. So we would look at other things like that. We could listen to the heart until we're blue in the face. We're not going to be able to tell if someone's dying or not. Now you could do something like an echocardiogram if someone has end stage heart disease and see how well their EF is working and all the different things and kind of predict, hey, the heart is functioning at this percentage, so likely someone's only has 6 months left to live, things like that. But just listening to the heart, no. I hope that helps. I've never been a hospice nurse for a family member. And when that happens, it'll be a curious day, won't it be? Hi from New Zealand. We are worldwide, Robert. Hello. Thanks for the videos. Have you thought about doing a video with a mortician about what happens post hospice death? Thank you for bringing this up. I need to do this. I've been thinking about either doing that or not doing a video, but maybe doing like a live or a podcast or something where I bring on where I bring on a mortician. I would love that. Does the degenerative aspect of dementia kill someone, or is it the effect of the dementia, like lack of eating, that kills? It is the degenerative aspect of dementia, because they eventually forget how to eat, they forget how to eat, they forget how to swallow, they forget how to do all the things. And then because of that, their brain starts going, okay, we are getting in this advanced part. We are getting into the advanced part of this disease. We are going to start shutting the body down now. So although it's sad, right? I don't want to say it's like, I don't want to act like just get over it. No, it's sad. It's hard to watch someone do that. But I would hope you take at least a tiny little comfort in knowing that our bodies knows that's going on, and they start shutting things down to help us die more peacefully. So it's not like so the body is start stops to the body starts feeling not hungry, starts feeling not thirsty. Oh, thank you, knee knocker. What prompted you to go into hospice? I, was an ICU nurse for many, many years, and for about 8 years, and being an ICU nurse made me wanna be a hospice nurse. Do you think people can pick when they leave? Meaning they can pick when they die. I do think they can. Not everyone, obviously, but I've seen it with my own eyes, people choosing when they're going to leave. I have one of my stories I always tell, "Thank you, Julie, teacher." She just gave me a little tip for my comforting view of the afterlife. Julie, you're so sweet. But one of the craziest ones I've seen is someone literally just saying, like, I'm tired, I'm dying tonight. And everyone's like, what? No, you're not. You are, like, she was dying, but not that night. And then she just decided she would, and she did. And she did not do anything to make that happen. She just knew. But I do think people can choose sometimes. Sometimes. Not everybody. Andrew says, "How do we know for sure? Science is kind of sketchy." Andrew, how do I know what for sure? Whoa, did you see how that happened? That the arrow went big. How do I know what for sure? I missed that. I missed that part. Oh, an autopsy is the only way to really know what type of dementia? It doesn't actually matter. All the way you die from dementia, any type dementia is like the umbrella. All people dying from that disease generally look the same at the very, very end, very, very end. Homebound question. I'm in the US, I am 50, I have metastatic breast cancer. Doctors differ on whether I have 6 months or not. Okay. So that's what it is. You have to get someone to say you have 6 months or less. Like, you have to get someone to say, "Yes, you have less than 6 months to live, and you don't want to continue treatment." And then hospice cannot deny you. I'm not, like, being annoyed at you, I'm being annoyed at the people saying that. Hospice cannot deny you. If you have a doctor who says you have less than 6 months to live and they refer you, they cannot deny you. Or I'm sorry, the hospice company can still deny you if they don't think you have less than 6 months to live, but the insurance company can't. But you have to remember that you have to stop all treatments for breast cancer. So, I do feel like, and it's up to you, Allison, obviously, but I do feel like with the metastatic breast cancer, sometimes if there's like a standard of treatment, like you do X, Y, and Z, and we know percentage wise you will live longer, I do feel like sometimes it's better to do like all the standard stuff first before you come on hospice, because I'm always game to have people come on hospice early. But there are some times, particularly if you're young, that when you go on to hospice, it could be too soon to help manage symptoms. But you know what? Like sometimes, because there's a lot of symptoms that can happen if you come on too soon with specific diseases. But you know what? Either way, you could always go on and come back off. You don't have to stay on there forever. I'm also an ICU nurse and want to get your book so I can better share information to our patients. Yay, thank you. It's not Eileen. How do you say your damn name? Hold on. Rich! Rich, are you out there? He's probably sleeping. Do, 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 do. Oh my gosh. I am Elaine, 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 Elaine. Oh my God. How could I not know that name? This is what I mean by like brain farts, you guys. Why does it seem hard for nurses in a skilled nursing facility to get on board that liquid morphine can be helpful unless I to get on board? Wait, sorry. In sniffs to get on board that liquid morphine can be helpful unless I buy them all your book. I'm trying to make sure it's ready. Oh my gosh, I love you. I know. I find the same so many other nurses, not just in skilled nursing facilities, but like nurses everywhere. I hear them say to me like, "Well, we're going to start the morphine like so I guess like wink wink." Like kind of like believing in what they're but like also believing that like we're here to like make them die quicker with the morphine and I'm like, it's other nurses saying this to me. I'm like, "You guys, no." I, try to wow, people are giving me tips tonight, Juliet. I try to sit there and educate them. I try to be like, "No, that's not right." Like, I can get I wouldn't say mean, I'm not mean at all, but I get like, "No, that's inaccurate. That's not what we're doing." Morphine I'll give, like, them the same spiel that I give my hospice patients, like, it has been clinically proven that little bits of morphine that are given on hospice does not hasten someone's death. It just helps them die more peacefully. All it does is relax their central nervous system just a little bit to make them feel better. There is no, um, we are not hastening anything, but I know it's hard. I try to educate the best I can, but sometimes it's like it's going in one ear and out the other, and they don't care. Juliet says, as an RN, how can I highly suggest to families when I see the patient truly suffering and is end of life, but is in denial that they should be a DNR and put into hospice? My empathy goes wild. Juliet, oh, first off, thank you for the tip. Second off, it's really, really hard when you're not a hospice nurse. I don't know if you are a hospice nurse or not, but I don't think you are. It's much easier when they're already on hospice or going into hospice to start talking about the end of life journey, which is how I word it. So, if there's a time because you need a lot I think you need time to do it too, and it's really hard when you're in the hospital. As an ICU nurse, I didn't have the time to do that really, right? But, like, if you can find the time and you know them and you're willing, and they're willing to listen, you can say, from my experience, right? From my experience, and I say this I say this to you as if this was my own mother or this was my own sister. I think it's important that you know this, that I think, that everyone has, that I always say, everyone has an end of life journey. Everyone, all of us here, you, me, your mom, we all have this end of life journey. And sometimes we can see when it's for some people, we can start seeing that it's getting closer. And from my experience as a nurse, I feel like your so and so, your mother, your sister, I feel like she's getting close to her end of life journey. I think we're getting close to it. And if we are there, if this is where we're at, which is from my experience, where I think we're at, what would you want that to look like? How would you want to be? Would you wanna be like this? Would you want to be would you want to be peaceful? Would you want to be at home? Would you want CPR done? So, that's how I would bring it up, literally, that's how I would do it, but it is really hard. It's hard when they are not ready and you're the nurse, and you're in the ICU and you're supposed to be helping them, stay alive. And, in general, our society thinks that, like, life at all cost is the hope. We just need to change that because none of us are going to live forever. So how can it be that staying alive is the ultimate? It's like, no, we can't. No, we're not all going to stay alive ever. None of us. And there's going to be certain diseases that we know are going to be the diseases that start our end of life journey. And in knowing that, how do we want to live out the rest of our lives until we die? Miriam just gave me a tip too. You guys, thank you. Okay, one last question. Jill says, I have pulmonary fibrosis along with stage 3B NSCLC. My pulmonologist says that if I decide that's what I want, he'll send in a referral. I know I won't get treatment. Can I still get PET scans? No, Jill, you can't get PET scans or CT scans. Nope. It's tough. It's tough. In pulmonary fibrosis, I don't see tons of, not that I shouldn't, but I don't see tons of patients with pulmonary fibrosis. I think just because of the nature of it, it's like this chronic, the deal, you have it, but like this chronic illness where you're kind of in and out of the hospital, you have exacerbations where you do get better, you get worse, you get better, you get worse. So, you always can go on and you can always come off. You can always go on, you can always come off. But it's just a matter of like how close to the end you think you are. If they truly believe that you have less than 6 months to live, if they really think that, I know it's hard to know that with pulmonary fibrosis, I think. Then you think about how you want to live out the rest of your life. Do you need those PET scans? Are you going to do anything with the results of the PET scans? Think about that, right? Maybe you PET scans for what? Like, because that's what hospice is going to say. PET scans for what? What are we going to do with it? What are we going to do with that knowledge? So it's hard. This isn't an easy decision, specifically if you have something like that disease that I feel like you've probably been living with for a long time. So I'd say like if you have good quality of life now and like you don't fully need a hospice yet, then maybe don't do it. If you feel like you don't have good quality of life and you just want to be home and have people coming to you and managing your stuff at home, then go for it for a while. And maybe you go off it after a few months to get the PET scan. But think about that. Think about once you got the PET scan results, what would you do with it? If you wouldn't do anything with those results, you don't need them. You know what I mean? So anyway, it's 6:01. It's 6:01. That hour flew by. You guys have made my heart feel so good. Thank you for being here. I started this live saying, I just felt really sad today there's not anything going on. It's just like the weight of the world kind of. And just being here with you guys and seeing all the familiar names, and you guys are so kind to each other in the comments. It's just really, it really, really helps me. So thank you. Thank you. Thank you. And I'll be here next Thursday, 5 p.m. Pacific Standard Time. And thank you for all who joined and asked such great questions. Love you guys. Thanks for all my tippers too. Amazing. Love you.